17% of the people have a deductible over $5,000. They can't afford the deductible. They go to the hospitals, and hospitals end up never getting paid, and they're going under. We've already mentioned Obamacare promised to keep the doctors, keep your health plan, and we of course all know that simply has not been the case. Insurers have limited their provider networks trying to cover the cost of this thing. Brian Webb of the National Association of Insurance Commissioners recently said that the individual market is a mess. I mean, how in the world can we look at this in any other possible honest way but to say this is a disaster?
Is the co-op program in Obamacare a complete failure?
No, not in my view, and I'll tell you why.
Well, okay, tell me why, or define to me what would be a complete failure if the facts. Well, let me just recite the facts again. 23 programs were given money just 2 years ago, and 16 of them have already failed. The 7 that haven't failed yet, 4 are on corrective action plans. Isn't that accurate?
No, 6 are on corrective action plans.
So of the 6 that haven't failed, 6 of them are on 7 that haven't failed, 6 of them are on corrective action plans?
Correct.
Oh, wow. So it's worse than I thought. Because of the last 4 that failed, all of those were on corrective action plans, and they all failed here. One in Ohio just a few months ago. So 23 started, 16 have failed. Of the remaining 7, 6 are on corrective action plans. Every other program that was put on, every other co-op that was put on a corrective action plan did in fact actually then later fail. $2.4 million allocated, 1.5 or 2.4 billion allocated, 1.5 given out and now lost. So, and yet you don't think that defines a complete failure?
No, let me just, if I can, Mr. Chairman, just...
So tell me what would be a complete failure.
Try to explain why. So first of all...
Well, let me ask this way. If all 23 actually fail, would that be a complete failure? Because that's where this is headed.
Well, I think we're seeing with the co-op program, as we are with other parts...
No, answer that question. If all 23 fail, will that be a complete failure?
I think if all 23 fail, it underscores how challenging the health insurance business is. I think it underscores...
But that's not what I asked you. Would it be a complete failure if every single co-op that you guys authorized just 2 years ago failed? Would that be a complete failure? Because we all know that's where it's headed. 16 have already failed. The 7 left, 6 are on corrective action plans, and they're going to fail too. So when all 23 fail, would that be a complete failure co-op program under Obamacare?
As I said, I think it underscores how tough this business is. I think it underscores how challenging it is to have it being a small business.
So, Mr. Coonan, you're from CMS. You're a witness here today, and I'm asking you to answer one question. If they all fail, if they all fall apart, like we know they're going to, is that a complete failure? Just give me a yes or no to that one. That's all I'm asking.
I'm saying, Mr. Chairman, it underscores again that this is a very tough business.
Is it a no?
It's tough to be a new entrant.
Is it a yes?
Business. And, Mr. Chairman, I've worked for an insurance firm that was about the size of one of the larger co-ops. We became successful, but I understand very, very specifically.
Are you saying some of these 16 are going to come back to life? They're not dead forever? They're going to miraculously revive and resurrect themselves? Is that what you're saying?
So what I'm trying to say is the following.
Or well, let me ask you this: Are you sitting here today and say you're going to assure me that the 7 left, that they're not going to fail? Those 7 are going to keep working. They're going to be fine. You telling me that?
Yeah.
Would you tell me that? Are they going to continue to be in operation? The 7 that haven't failed yet, are they going to still be good when you come back here in a few months and we have the same kind of hearing?
Nobody could make that kind of prediction, sir. But let me tell you one of the reasons why. It's because there are so many variables that can impact the success of a business like that. Most fundamentally, claim costs. So, for example, if an issuer like a co-op has a very tough year...
But we just heard from you, Dr. Bloomberg, and the ranking member that Obamacare is the greatest thing since sliced bread. We just heard that, and yet we have this phenomena in front of us. 16 of 23 have completely failed, and we know the other 7 are going to fail. And yet you just all told us Obamacare is the greatest thing in the world.
I'm a numbers guy.
Yes.
In a Medicaid patient, the amount of money spent per Medicaid patient is higher than the other patients typically. I know it is in North Carolina, exponentially higher.
Yeah.
So what you're saying is that we need to go to a model where we spend more per patient?
No, I'm actually saying the opposite. What I'm really saying is that one of the interesting things I'm seeing in talking to CEOs is that they are retooling their care management models. They're retooling their provider contracting to match a number of issuers. that have been successful in this business from the beginning. And what we're finding, Congressman, is that there's a clear opportunity for issuers that have thought of this market more strategically, that have used a lot of data to understand the specifics of their market, understand the uninsured in their state, design products that meet them, tier networks if appropriate, and provide new cost management tools.
Yeah, but
that's what I'm
So
saying.
let me go to one of the biggest ones, Blue Cross Blue Shield.
Yeah.
In my state, obviously the largest provider. They have gone up 30%, 34%, and anticipated 20+% this year in terms of the insurance rates. We're hoping that it's lower. I talked to them just 2 weeks ago. So when you look at that, you aggregate all of that together.
Yeah.
That is not affordable health care.
Yeah.
And certainly my rates are not anywhere close to what they used to be 3 years ago. And so fortunately I can afford to pay it. Many cannot. I mean, they're just barely scraping by.
Yeah.
What they shared with me is that emergency room visits are not really down. Is that correct? Because that was the whole premise. We would get this group of uninsured from going to use the emergency room as their primary health care provider. And actually, they're saying that went up and it continues to stay at an elevated rate. Are you finding that?
Yeah. So a couple of things that you've raised. First of all, is that if you look at cost increases are at the lowest level during the ACA than they've been historically over the past 50 years. So that's
the lowest level
so
of
that's
what?
one.
Okay,
So
what are we comparing to?
So I'm just,
Mr. Cunahan,
Yeah.
how can you say lowest level? I mean, I'm 57 years old. I've been paying insurance premiums for over 35 years.
Yeah.
So 35%, 30%, and
Yeah.
18 to 20% is not the lowest level of increases that I've faced. That is just factually incorrect.
but if you've looked at the average in the markets, so for example, if you looked at the cost increases on average.
Let's look at just North
nationally,
Carolina. You know I was going to be here, and you know my numbers, and so let's look at North Carolina. Is it better in North Carolina over the last 3 years than it was in the previous 10 years in
Well-
terms of rate of increase?
Yeah, and unfortunately, Congressman, I don't have the benefit of the insight of North Carolina per se.
Well, you can
But
report
what
back to me.
But I can speak to nationally, and I can tell you from 2000 to 2010, the average rate increase was 8%. From 2010 to 2015, it was lowered to 5%. So look, do we?
But
So I'm
Mr.
talking
Cunahan,
nationally.
so what you're saying is we're an anomaly in North Carolina?